Good afternoon, everyone. My name is Dr. Eric Turing. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine. And I want to welcome you today to our CE webinar. A couple of administrative announcements before we begin. First of all, this session is accredited by by RACE. It is approved for 1 hour of continuing education. To acquire the continuing education certificate, participants must participate for the duration of the event. CE certificates will be emailed to attendees approximately 7 to 10 days after the event. Questions, if you have questions during the course of the presentation, please submit those through the Q&A feature of Zoom. At the end of the session, after Dr. Daut completes her presentation, we will have her answer the questions. This program is highly dependent upon volunteers. So if you're interested in speaking at one of our CE webinars or know someone that may be a good speaker for our CE webinars, please let me know. You can reach me at admin, A-D-M-I-N, at acvpm.org. And we can get you set up for a presentation. And then finally, this presentation will be recorded. In about a week or so, we will post a recording of the presentation on the ACVPM YouTube page. So with that, I would like to introduce Dr. Elizabeth Daut. Dr. Daut is a Natural Resource Officer in the Biodiversity Division at the U.S. Agency for International Development, or USAID, where she has worked since 2017 to improve global biodiversity conservation efforts, including combating wildlife trafficking and supporting integrated cross-sectoral One Health development approaches. She is co-coordinator of a private sector partnership opportunity called Health, Ecosystems, and Agriculture for Resilient, Thriving Societies, or HARF, designed to co-develop transformative and integrated solutions to benefit high biodiversity landscapes and the communities dependent upon those landscapes. Prior to joining USAID, Elizabeth completed a postdoc at the National Socio-Environmental Synthesis Center, where she investigated the risk of introducing infectious pathogens from global wildlife trade. Elizabeth has a PhD in veterinary pathobiology and applied biodiversity science from Texas A&M University and a DVM from Cornell University. So I will turn it over to you, Dr. Daut.
Thank you very much, Dr. Turing. You did a very good job with the very long acronym, which was HARF. Very consistent for government work. But thank you again. It is a great pleasure for me to be here and have the opportunity to share some insights about healthy ecosystems and really their role, their like fulcrum of the One Health Triad, something that I have a big interest in. So because this is, I know you're getting continuing education credits, just to kind of summarize what we will be discussing, I'll give a brief overview of One Health, and then highlighting more about ecosystem health, like what it is and how it contributes to One Health, and then some opportunities for moving forward holistically. So what is One Health? There are many definitions of One Health depending on the organization or the institution and what those their priorities are. At USAID, a very cross-sectoral group of colleagues from global health, so MDs, food security, environmental sector, and then also the humanitarian assistance, kind of the emergency response sector. We all came together and kind of co-created this definition, which is really specific for USAID and our kind of international development work. And it is One Health is a collaborative, transdisciplinary approach that recognizes the interdependence among the health of ecosystems wild and domestic animals and humans to achieve resilient and sustainable outcomes across complex systems from local to global levels. So, but what I like to think of it as One Health is really like a mindset. Some people call it an approach or a framework or a decision-making process. I like it as thinking of it as a mindset, and where you kind of strategically view a situation or a problem through a One Health lens. So you consider the various facets and interlinkages among human, animal, and ecosystem health at the same time. So there are, in addition to all of the definitions of One Health, there are many kind of diagrams, like Venn diagrams, similar to this one. I like this one because in addition to representing the interlinkages among the three sectors, you have human, animal, and an environment, it also includes many of those really kind of complex challenges that influence or even can undermine One Health or global health efforts. So things like mining or globalization or population growth. These are challenges that cannot be solved by one sector alone. And it's also important to point out that there are numerous global health threats that could really use a One Health approach or this mindset. They could, or really I think should be, addressing them through this One Health mindset. Certainly now under the current situation, the literature and most of the global health efforts are focusing on infectious diseases, understandably, and that's what I also will highlight as an example today. But there are other really complex, wicked problems that need One Health thinking, like antimicrobial resistance, kind of this slow-moving pandemic people have referred to, but then also climate change and pollution. So, historically, the environmental sector plays an essential role in public health, yet it is often underutilized. It's kind of underappreciated in its role with health security. And at the same time, the contrary is also true, where the public health sector is underutilized to help conserve ecosystems and natural resources. But we do need to do a little better at integrating all of the elements of One Health. And this is just a comment from the Lancet. There are, just to show one example, there are many examples like this that highlight kind of the neglected component, the environment or ecosystem health as part of the One Health triad. Now, but the good thing is that certainly over the last year and a half, due to the current circumstances, there has been a lot more discussion about healthy ecosystems and the role that they have with human health. And this is no doubt due to kind of the converging crises that we have of climate change and COVID-19. And this is one example of a recent publication. This came out from WHO a few months ago on kind of a compendium of guidance on health and environment. And I really like that this type of language is getting out there, particularly from primarily human health focused organizations. And it says human health and well-being depend on the natural environment, which is the source of clean air, water, healthy soils, and food. The natural environment comprises ecosystems, which when healthy and thriving, also confer protection against climate change and disaster risk. So when you think of like what is one ecosystem health, again, there's many definitions, but I like to think of it as homeostasis. You know, like what is the status of the current system? And, you know, what is the potential that this organism, you know, this big system can maintain itself and maintain its normal function and resilience to different stresses, and continue to provide quality ecosystem services like clean air and water for now, like for us right now, but then also really importantly for future generations. And so elaborating a little bit more on why ecosystem health is so important, when you think about it, it really is true that all sectors of society are ultimately dependent on well-functioning, healthy ecosystems and the services they provide. Now, we mentioned a few already, like the World Bank, or sorry, the WHO report highlighted some, but this figure on the right is from World Wildlife Fund and their 2018 Living Planet report. And I like it because it has the four groupings of what's kind of recognized as the big groups for ecosystem services. There's regulation, support, cultural, and kind of provisioning. And the provisioning are what you may typically think of, like food and other natural resources, water. But there's, you know, more nuanced services that we may not think of so commonly. And, you know, it's like water regulation and pollination, disease and pest regulation, soil formation. And I really like the cultural aspects. And I think this is really poignant at this day and age during COVID, where there has been a lot of recognition of the importance of green spaces and getting out into nature and the strong benefits it has for mental health. And it's also important to highlight that it is widely recognized that these four kind of environmentally focused goals, the life on land, life below water, clean water and sanitation, and climate action, that these four goals are really the foundation for the other 17 sustainable, or for all 17 sustainable development goals. And hopefully many of you are familiar with the SDGs and, you know, this kind of global recognition and kind of effort to reduce extreme poverty and inequality, and really to try to help protect the planet by 2030. So lots to do still. So what are the consequences of poor functioning ecosystems? Well, you can imagine like all of those ecosystem services are going to be somewhat compromised. We can have biodiversity loss, and that can be from, you know, microscopic, it's genetic, you know, all the way up to big, you know, megavertebrates. Food insecurity, increase in pollution and climate change, and increase in pest and pathogen emergence. So we're going to shift gears a little bit. And now, as I alluded to it earlier, we're going to kind of focus on those infectious diseases. And here is a list of the top recognized drivers of emerging zoonotic diseases. And this list I pulled out of a report from the UN Environment Program, which kind of synthesized the research up to this point, which really strongly recognizes these as key drivers. And, starting with increasing demand for animal protein. And that often leads to kind of unsustainable agricultural intensification, habitat loss, destruction, land use changes, encroachment into more natural, wild, pristine areas, increased use and exploitation of wildlife, unsustainable utilization of natural resources, travel and transportation. In today's globalized world, we all know that this is a big factor. Changes in the food supply chains, and then climate change. So this is quite the list, pretty extensive, lots of really broad, complex kind of issues or industries that we may not be able to influence a whole lot. But what we can do is kind of focus on at least one aspect of this emerging infectious disease risk, and focusing kind of early on in an early stage, and that's pathogen spillover. So just as a refresher, it's estimated about 75% of all new infectious diseases have their origin in animals, and about 800,000 viruses exist primarily from mammals and birds that could be zoonotic and pose a threat to human health. And what that indicates to me is that taking a virus by virus approach, where we're just kind of responding to new viral outbreaks, may not be all that efficient, and it could be beneficial to include kind of more holistic preventative thinking to kind of complement other efforts. And I like this diagram because it actually has a stream, and you can kind of think about like upstream efforts and what can we do to mitigate spillover risk upstream, before it gets down into the markets and has access to urban areas and kind of amplification. So really thinking that upstream mitigation of the spillover, those kind of initial spillover events, can complement the traditional kind of detect and response approaches. So this article highlights one of the kind of key kind of upstream factors that we can potentially influence. And this is a seminal article that came out in 2017 by Allen et al. And it determined that zoonotic emerging infectious disease risk is higher in forested tropical regions, kind of the those more healthy ecosystems that are experiencing land use changes and where wildlife diversity is high. And there have been many papers that have found these similar results. So just to give an example of like, well, what is going on upstream? So this is a couple of maps taken from this, it's this kind of service. It's called MAAP, and there's almost live monitoring, satellite monitoring of ongoing deforestation in most of the Amazon, certainly in Peru and Brazil. And this is some documented deforestation between June 2017 and August 2017 along the interoceanic highway. So this highway now connects Brazil, transects through the Amazon and over to the kind of western South America. So it goes through Peru. So it goes from east to west. And it was very controversial, and there was a lot of concern from environmentalists about what this would have, what impact this would have. And there's been a lot of investigation about how this road has increased the amount of deforestation in what were, fairly pristine natural areas. And these are a couple of photos I took when I did my dissertation research in Peru, and particularly in southwest Peru, where the highway transects, there is a lot of illegal gold mining. And this road provided access to these miners that will go in, and through the process, it's alluvial gold. So through the process of kind of trying to wash out the gold from the soil, it essentially is converting this lush, dense, humid tropical forest to desert. Like all of this sand colored section is sand. Once you get rid of all of the kind of upper vegetation, you don't have much organic material left in this soil, and it's extremely hard to kind of regenerate anything, let alone tropical forest. And along the roads, you get a lot of these kind of like shanty towns almost popping up, where there's a lot of health issues. I'll just leave it at that. So that's what you're seeing is an example of some of the land use changes occurring upstream. Let me just check. Okay. And so this is like, I kind of like the medical analogies. And I like to think of roads and the kind of subsequent impact that they have in medical terms. And really thinking of the first line of defense is our skin and the integrity of that system. And when we have lacerations, that compromises the integrity of the body and that effective barrier for the immune system. And roads are, I think, very equivalent. They are lacerations that compromise the integrity and health of the forest ecosystem. So what we're really kind of striving for is to support strong landscape immunity. And that includes the ecological conditions that are needed to maintain strong, healthy immune function and the resilience to respond to lacerations or other stressors, for the wild animals, and then other biotic elements that kind of comprise all that is within a healthy ecosystem. So when this may not be a surprise, but when you have ecosystem degradation, there are consequences. And one of the big consequences is you get more edges. So in that map of the deforestation in Peru, you see kind of like this very patchy network. And it has a lot of increased edges where you can have increased opportunity for effective contact between the infected shedding host, like a bat, for example, and the susceptible human, for example, or other animal. So more edges. And what you also see, and I'll go through a little more nuanced aspects, but keep that, often doesn't come to mind of what happens when you have ecosystem degradation. You can see shifts in the wildlife community composition and the species that stay there. When you have really degraded ecosystems, you see this homogenization of the species. So instead of having the full range of little rodents, all the way up to big predators, in degraded landscapes, you tend to see just those animals that are adaptable to kind of converted secondary quality habitat. And those are often rodents. And as I'm sure you know, rodents are very effective zoonotic hosts in many cases. So we're almost setting up the situation to have more of these animals, these species that could carry zoonotic pathogens. And also with some really cool research out there, there has been documentation of how deforestation in degraded landscapes actually increases the stress hormones in both birds and mammals. So not only are you kind of leaving animals that have, or species that have the higher risk of carrying the pathogens, but then you're also stressing them out where they may have a higher potential of shedding virus because they're stressed. And then what also happens is, and I'll go through an example in a little more detail shortly, but you can, for the animals that are left there in the kind of the degraded habitat, they may not have enough food, and so they can be food insecure and they're nutritionally stressed. But then what are they going to do? They often may migrate to other areas that could bring them into more urbanized areas where they could have higher contact with humans. And then just to give an example that many of you are probably familiar with is that degraded ecosystems, deforestation, can increase the transmission of malaria and other vector-borne diseases. Malaria there's been a ton of research on malaria, and this is one very well-studied pathogen. And the research can be show different results, but there have been some really good kind of systematic reviews that demonstrate under the conditions where you do see this really increased malaria transmission, and it's at that edge, kind of that leading edge of deforestation. So I mentioned I was going to get to the nutritional stress example, and we'll kind of walk through some of these spillover examples. The first one starting with Hendra virus in Australia, where Dr. Raina Plowright has been doing a lot of fantastic research, on the ground field research for a number of years. So as mentioned, these degraded landscapes can increase spillover. And what's going on with Hendra virus is that there's a lot of land clearing for agriculture and urban development. And it's decreasing the number of wintering flower eucalyptus trees or habitat for the fruit bats. And that's particularly important, kind of the seasonal aspect. During the winter, there's normally less flowering trees anyway. So these bats are nutritionally stressed and they can migrate long distances. And so they are going to where they can get the food, which is around urban, peri-urban, at least areas where there are humans that they often have fruit trees on their farms, and the bats will if the trees are in the fields where there are some horses, they're eating the fruit and they can, defecate and urinate and then infect the equine hosts and then subsequently humans. And it's a similar pathway for Nipah virus, another very similar paramyxo virus in Malaysia and Bangladesh. And another example is right here in the US. I'm currently in Vermont, so this is a very relevant for me. So Lyme disease, and there's also has been quite a bit written about this, and I'm sure there's some experts on the call that know a lot more about it than I. But there's evidence that increased habitat fragmentation, just like in the Amazon Peru photo, there's more edges, there's more patches. And as a result, this invasive shrub, Japanese barberry, it likes those kind of edges, as does the black-legged tick and the reservoir host. It's kind of creating an ideal habitat for the vectors and the hosts, reservoir hosts. And then one last example, a trematode, Schistosomiasis in Senegal. Some really interesting research from Dr. Sokolal at Stanford, where she determined that there are these dams on fairly small rivers, but they're preventing this native prawn to migrate up the rivers, which is decreasing their predation. They eat this snail, this native snail, that is the intermediate host for the parasitic fluke. And as a result, the populations of the snail and the fluke have flourished, and there have been increased cases of the schistosomiasis in the human communities. So those are some examples, but now what can we do? Well, there are opportunities, thinking holistically. How can we complement some traditional One Health efforts? And you may be familiar with this it's almost like a buzzword now, this nature-based solutions. Others I've seen call it ecological countermeasures is another one. But the idea is kind of using the natural ecosystem elements to help kind of mitigate some of these health risks. And there are various categories of these nature-based solutions. You can have a combination of ecosystem elements with kind of traditional engineering interventions, or you can have like pure ecosystem elements to try to address whatever the development issue is. For example, coral reefs is often mentioned as an example how they can help mitigate the strong waves that come in from like a hurricane and thereby kind of decrease the amount of damage that can cause on coastal habitats or populations on the coast following a hurricane. So here are some examples following on the previous ones that we explained. So these natural-based solutions can help and be a contribution to this One Health approaches. So, for example, you can restore ecosystems, you can reforest areas, and to try to decrease the kind of the patchiness, decrease those edges and potential exposure sites, and improving the ecological integrity. And when I say ecological integrity, I'm thinking more like the ecosystem health, right? And it's important to note only 40% of the remaining forests have high ecological integrity. So, there's a lot we could do to try to restore and increase that percentage. So as far as the example with the Hendra virus, strategic planting of some of these winter flowering eucalyptus trees in the degraded forest could really help the bats' nutritional needs and help decrease their migration to urban areas, and that they want to not migrate to the urban areas because those fruiting trees, which we consume, is really poor quality nutrition for the bats. So they would much prefer, feeding on their natural food sources. Remove invasive plants that support populations of zoonotic pathogens, vectors, or hosts, like the Japanese barberry. Similarly, you can remove the plants and then restore forested areas to decrease edges and kind of increase higher quality forests, that kind of ecological integrity. And lastly, as far as the Schistosomiasis example, removing the dams if possible, or providing ladders for the prawns to migrate. And they have done this and have shown a significant decrease in the number of cases in the human populations. So just to summarize, these are kind of the key take-home messages I hope you will be able to share with your colleagues. Ecological integrity is an ecological service that benefits human health. And ecosystem health is critical for holistic One Health approaches. It can really complement traditional sources. As I said here, so natural-based solutions help prevent spillover at the source, kind of upstream, where it can be a little more cost-effective, and complement traditional One Health approaches. And with that, I thank you. This is a photo of my foot overlooking the edge in another amazing area in Peru. And it's just to remind me to say, like, together, if we work together cross-sectorally, thinking, in a One Health holistic manner, we really can save ourselves from going over the edge. So thank you very much. And I'm more than happy to take some questions.
Great. Thank you very much, Dr. Daut. So with that, we have a question that I'm going to try to activate the individual's microphone and let her answer that question. S. Miller, if you just give me one chance here. If you could ask your question of Dr. Daut.
Hey, yes. When I'm working on, ranches and animal agriculture and industries, sometimes they'll bring up questions like, well, Doc, I don't understand why fill in the blank livestock is so bad for the environment. How else are we going to use this land? You can't plow it and you shouldn't put houses on it. So I always wonder, I think we all hear more about sustainable and non-sustainable agriculture. And at least I, for one, read way too little objective evidence about agricultural practices and their impacts. How is this planet going to feed its humans, let alone let the flora and fauna subsist as the population exceeds 8, 9, 10 billion without fairly robust and pretty large agricultural systems? Over.
Yes, thank you. That's quite the question. I may not be the person to best answer that question, but I'll give some insights, mostly gleaned from my food security colleagues at USAID. And as Dr. Toreen said in the introduction, my bio, I work on this other project called Hearth, which is health, ecosystems, and agriculture for resilient, thriving societies. And with that project or kind of initiative, we are really trying to support sustainable agriculture, which is like, what is that? It is hard to conceptualize, let alone define. But there are movements that have good evidence and approaches, I should say, that fall under regenerative agriculture. And one of the big issues is the soil degradation that is occurring from current practices. And this regenerative agriculture approach is at least trying to maintain the quality of, or hopefully replenish the quality of the soil, so there can be potentially less products needed to maintain the same amount of production. And it is hard, like depending on the system where you work. It sounds like you're working in grasslands. What are the benefits that you kind of have to think about the cost benefits analysis, which sounds like some of your clients are thinking about, like what else are you going to use that land for? And just thinking about the resilience of that land, and at least making sure that the land is healthy enough to be able to withstand shocks like droughts or flooding. We need to make sure that at least all of the elements of what would be normally a healthy ecosystem are there and stay there, so there can be this kind of resilience response to some pretty dramatic stresses that are going on in the world. I hope that answered, or at least part of it.
Yeah, I think it does. And I appreciate, your thoughts on, it does matter what kind of ecosystem you're in, Are you in country like Peru or grassland or mountains or what? Thanks.
Yes, absolutely.
All right. A couple other questions have come in. I'm going to see if Dr. Donna DeBonis can ask her question.
Yes, hello. Thank you so much for your presentation. I enjoyed it so much. I was wondering, considering that you're all across the world in, it looks like some very unusual and rural places and perhaps undeveloped, you have the opportunity to determine if the indigenous peoples of those areas perhaps instinctively live a One Health approach.
Wow, fantastic question and great insights. And I would say a resounding yes. We have a lot to learn from indigenous communities, and it's called TEK, traditional ecological knowledge, TEK.
Okay.
And there's a lot of effort to try to raise the awareness of how much they could help us with, monitoring managing really these complex systems, because, many indigenous communities have been living, sustainably. Again, that's not a great word, but living well in their native territories for thousands and thousands of years, and understand kind of holistically how to manage the ecosystem to preserve those ecosystem services. They're certainly not thinking in those terms, and those very categorized, kind of scientific terms, but just innately have the experience and historical knowledge to maintain those systems. So yes, I think it is unfortunate that we haven't benefit, or we've kind of marginalized a lot of indigenous communities, but that is changing. There is definitely a lot more effort to engage them more. Thank you. Great question.
Thank you.
Okay, Dr. Boris Bergwitz has a question with regard to trap neuter release programs.
I've noticed that you've written a paper about parakeets in Peru and concerning Newcastle disease. And have you, in your adventures, encountered anything with cat? People maintaining wild cat populations, and what are you? We know that they can devastate the bird population and so forth. But do you have any? I don't know. Is there any ongoing studies concerning this that you're monitoring over?
Yeah, no, another great question. And let me just clarify, you said wild cat populations?
Okay. I meant like feral cats, domesticated cats that are stray. Yeah. And a lot of people have taken it upon themselves to do trap and neuter release and, maintain that population. But, that's in the US, but I've never traveled much outside the US, and observed feral cat populations over.
Right. Yeah. Interesting. Another great question. And I do have a little bit of experience from that, but not in Peru, but in Ecuador, where I was for almost a decade. And I was helping some folks on the Galapagos Islands. And, unfortunately, there are a lot of domestic animals, some of which have become feral in the Galapagos, like the cats and somewhat dogs. And like you said, they are very, cats particularly, are extremely efficient hunters and really can decimate wild bird. And on the Galapagos, a lot of the issues are like all the little lizards, the endemic lizards. So they can wreak havoc on those native wildlife populations. And there was some efforts on trap neuter release. And at the time I was optimistic that a combination of sterilization, community awareness, kind of increasing pet ownership responsibility, along with kind of enforcement of regulations, would be able to pull the kind of the situation under control. You would think on an island would be able to do it, but it is challenging wherever you work on those efforts. And cats are such prolific breeders, you really have to stay on top of the situation and have all of those components, I think, in order to be successful. Regulations where like no additional cats or dogs are allowed onto the islands. That unfortunately is not enforced, or at least it wasn't, I should say. I'm not sure what the situation is right now, but when I was there, they weren't being enforced. And a lot of the owners would let their animals just run freely. So I think having the combination of, trap, neuter, release, get rid of the, I shouldn't say get rid of, but, minimize the population through attrition, then in combination with the education and regulation could work. But that's a very unique situation, I would say, being on an island. I really don't have experience with it elsewhere, so I can't really speak to that.
Okay, Dr. Daut, would you have time for one more question?
Sure.
Okay, I'm going to activate Dr. Mary Evriet's microphone. Dr. Everett?
Hello, good afternoon. Thank you for this great presentation. I was curious if you feel that these satellite surveillance methods will ever develop sufficient sensitivity and specificity to give timely warnings of zoonotic outbreaks, that they would be on that upstream side that you were talking about. Thank you.
Yes, thank you. Great question. And there's a lot of interest in this topic, as you can imagine. Kind of across the U.S. government, and so the satellite imaging is one really critical component to help create a surveillance kind of early warning tool. And I'll just note, if anyone is interested in more about this, you can see an example online. It's called Fusenet. It's FEWS. And it's a famine early warning system that uses satellite data. And colleagues from like NASA and NOAA help contribute a lot of the data. But they're using satellite data, but then other types of data too, thinking about what are all the factors that could influence spillover risk kind of upstream. Well, we need to have the habitat health factors, right? That ecosystem health factors. A lot of that is deforestation, but other factors too, like we may need to get on the ground and evaluate water quality, soil quality, how much pollution or contamination is there, and then also looking at, obviously climate is a huge factor. NASA's critical with and NOAA, they're both really critical with providing those data, and then all of the kind of socioeconomic factors, like how good is the health services in the rural communities? How is their nutrition? What is the quality of the food sources that they have? And then also those kind of ecological factors I mentioned about the wildlife populations. Are we in an area that doesn't have any predators left, and it is just kind of rampant rodents? Pulling all of those data sources together, I think really could create a robust kind of early warning tool that could at least help. We could pilot it and validate it, like actually get on the ground and do some sampling. It could really help direct some of the funds and decision making. So there is a lot of discussion about this need, and I'm hoping worldwide there's a lot of discussion about this, but I am hopeful that this will be something that we will be able to use in the future. Thanks.
Okay, I'm going to go ahead and say that we have completed all the questions, and some fantastic questions, insightful answers. I do want to thank Dr. Daut one more time for a very enlightening presentation. One Health is something that I believe veterinarians have a very good grip on. We can always use more information to educate others around the world and in our communities about One Health and the importance of recognizing the interaction between ecosystems, people, humans, animals, and the environment. So I want to thank you again. And with that, I'm going to close this session. Thank you, Dr. Daut, and thank you everyone for attending. We will be scheduling our next CE event in the coming weeks. So watch your emails for an invitation to the November webinar. Thank you very much.
Great, thank you.